Aiming to prevent overdose deaths is now heading to the Senate. The bill, sponsored by U.S. Senator Tim Kaine of Virginia, would make a life-saving drug more widely available. Allie Hines talked with Senator Kaine today, who says the bill would help get a safe and effective antidote to opioids into the homes of people at risk of overdose.
Josh, this bill, called the Co-Prescribing Saves Lives Act, encourages physicians to co-prescribe naloxone alongside opioid prescriptions. It also makes naloxone more widely available. Health professionals say when someone is experiencing an overdose, this drug can quickly save their life.
The number of opioid deaths in the state of Tennessee is more than motor vehicle accidents.
Just one of many statistics social worker Cecily Alvis says points to a need for more access to naloxone.
Having access to something like naloxone could save potentially many lives.
The drug comes in the form of a nasal spray or injection and typically takes effect within minutes. Alvis is the site director for Frontier Health's Crisis Stabilization Unit. She says the majority of substance abuse cases involve opioids, drugs from Percocet to heroin.
We are substantially higher in the northeast region of Tennessee than the rest of the state.
In Tennessee, laws have been passed in recent years allowing doctors to prescribe naloxone. Alvis says before naloxone is ever needed, the addiction can begin with a prescription.
Many of these opioid addictions start when you're a teenager. And so as a parent, if you have a child and they are injured or they go to the dentist and the dentist or the doctor is wanting to prescribe some sort of medication, I'd be really mindful of what that medication is that they're receiving.
It's just shocking what had been done with these drugs over the last 20 years.
Democratic Senator Tim Kaine says even with more access to naloxone,
it's a lifesaver, that's great, but the real way to battle this problem all around the country is to tackle the massive demand for these drugs that has been frankly fed by unethical marketing practices and lack of sufficient education.
He says the only way to solve the opioid abuse problem in the long run is to cure the problem of overprescription. We talked with a family last year, just days before Senator Kaine introduced this bill. That family believes naloxone could have saved their son from dying from a drug overdose.
Allie Hines in our newsroom. Allie, thanks. A U.S. Senate committee passed the bill today, and it now advances to the full Senate floor for a vote.